What we found is that there's a new technology for treating reflux that can get people off of their medications. The problem is, because surgery hasn't been used in 20 years or so, we didn't have a good way to evaluate the patients. Those centers were spread out throughout the state, frankly, and we decided that there was a need to have a center put together that could do all the different types of diagnostics that we need to identify reflux patients. Forest Park stepped up to the plate. They bought all the equipment. We got associated with some of the gastroenterologists in town that we hadn't done any work with before, and they've taken the lead to run the center, to do the diagnostics, and to give us the information we need to appropriately treat the patients. We do pH studies, we do pressure studies of the esophagus called manometry. We also do regular endoscopy to look and obtain pathology specimens. And the best test that we have now is called impedance. Impedance is a test in which we're able to actually measure the movement of fluid up and down the esophagus. So where the fluid may not show up in some of the other tests, for sure it's going to show up in this test. The difficulty that we had in the past was we were sending patients one place to get pH, another place to get manometry. We had to send patients down to Houston to get impedance. And so now having all that equipment in one space becomes very convenient for the patient. I think because there's so much information out there on the internet, on the TV, people understand that they have a problem. They have reflux, but they don't understand all the options that are available. When they come in to see me, I'm going to talk about their symptoms, how they relate to reflux, whether it may be due to some other disease process. We're going to talk about the anatomy. We're going to illustrate the anatomy to them in pictures. And then we're going to talk about the different tests that we need to do to confirm that this is actually what we're dealing with. And then we'll talk about surgery if it's indicated. And rather than having to send patients across the state to get that study done, it's something that we could do right here in Forest Park, Dallas.